some children, there are unrecognized difficulties. These are children with mental, physical, or emotional delays that will become more serious if not detected and treated during the important early years of life between birth and age 6. Unfortunately, subtle delays are hard to detect in infants and young children. As a result, too many of these children are not identified early, when intervention is generally most effective and least expensive. That's why the Denver tube was developed. The Denver tube is a simple and inexpensive test to screen children from birth to age 6 who have no apparent signs of developmental delays. It is the new version of the Denver Developmental Screening Test, which has been used to screen the development of more than 50 million children around the world since it was introduced in 1967. The Denver tube was normed in 1989 on a sample of 2,096 Colorado children. It consists of 125 activities that are fun and interesting for children to do. Materials for testing are contained in a test kit. These are a red yarn pom-pom, raisins and a small glass bottle, a rattle, a bell, a tennis ball, a red pencil, a small doll with a feeding bottle, a plastic cup, and 10 colored blocks. Materials in the test kit have been carefully selected and were used in the standardization sample, so replacements must be duplicates of those in the kit. In addition to these materials, you'll need a lead pencil and blank sheets of paper for the child to draw with, and a blanket if you place babies on the floor. A watch is useful for timed items. 2 manuals accompany the Denver tube. The Denver tube training manual contains detailed instructions for testing, scoring individual items, and interpretation of the test. The technical manual includes information about standardization of the Denver tube, how to train others to use it, and how to set up a community screening program. This is the Denver tube test form. The form has lines at the top and bottom that show ages in months and years from birth to age 6. Each of the 125 test items is represented on the form by a bar that indicates the ages at which 25%, 50%, 75%, and 90% of children in the norming sample were able to do the individual items. For example, for the item dress no help, 25% of children in the norming sample dressed without help at 3 years. The hatch mark shows that 50% dressed themselves without help at 3.5 years. The left end of the shaded area shows that 75% dressed alone at 4 years, and the right end of the bar indicates that 90% of the children in the sample could do this at 4.5 years. Some of the items have a small R in blue on the left end. These indicate items that can be passed by parental report. Some have a footnote number on the left end. These refer to instructions on the back of the test form. The 125 items in the Denver tube are arranged on the form in a manner similar to a growth chart, with items done at an earlier age on the lower left, and harder items going up to the right. Like the original DDST, the Denver tube is arranged in 4 sectors: personal, social, fine motor, adaptive, language, and gross motor. Many more language items have been added, and some items have been altered or replaced to reflect the changing world in which children live. Now that we've had a look at the test materials and forms used in the Denver tube, let's look at the steps in administration. This will include preparing the child and caregiver, explaining the purpose of the test to the parent, correctly calculating the child's age, accurately drawing the age line, knowing the guidelines for the order of testing, scoring individual test items, and the number of test items to administer. To get the best response from the child and accurate responses from the parent, it's important to make them both comfortable. The child needs to be able to reach the test materials easily. Ideally, you want the child to be able to rest his or her arms on top of the table. A young child can sit on the parent's lap. If the child is still too low, ask the mother to use a folded blanket to raise the child. A A child-sized table and chair are ideal for testing an older child, while a baby may be tested on a table or on a blanket on the floor. Once the child and parent are comfortably seated, explain the purpose of the Denver 2 to the parent.
Mr. Ketter, what we're doing here today is looking at Grant's current development. This is not an IQ test, and I won't expect Grant to do everything that I ask of him.
While you're doing this, put out a test item for the child to play with and watch to see what happens. Some parents may be anxious about the testing, so explain that the Denver 2 is used to see how the child's development compares with other children of the same age. Tell the parents that the Denver 2 is not an IQ test, and the child is not expected to do all the items. The third step is accurately calculating the child's age. To do this, write the date of testing by year, month, and day. And under it, write the child's birth date, also by year, month, and day. In this example, the date of testing is May 10, 1990. Mark the age at the top and bottom and use a straight edge to draw the age line. Write the date of testing at the top of the age line. Adjustments for prematurity should be noted at the top of the form in this manner. Each child is a little different, so you must be flexible when you administer the Denver 2. There are some general guidelines that will help make that process smoother. In general, begin by talking with the parent about report items in the personal social sector while the child plays with test items and gets comfortable in the test setting.
Mrs. Spicer, let me ask you a question about her. Is she able to brush her own teeth?
No, I do brush them for her. I would never give her own toothpaste.
Okay, fine, she hasn't able to do that yet.
Right.
While you're talking with the parent, be watching the child's play to see what test items the child does spontaneously. Informal actions, even if you see them before or after formal testing, count as part of the screening. Follow the personal social report items with fine motor adaptive items that let children have successes without requiring them to talk.
Now, what I'd like you to do is I'd like you to draw a person for me, okay? Draw the best person you can, and you put it right here on the paper, okay? Go ahead.
Do the language items third, after the child has had a chance to become relaxed with you.
Nikita, I'm going to ask you some questions. I want you to listen carefully and answer, okay? What do you do when you are cold?
A jacket on.
You put a jacket on, all right?
Do the gross motor items last. This is because some children get very excited with the hopping and other gross motor activities and don't want to sit back down at the table to do quiet items.
Right over that paper. Good for you. That was perfect.
In each sector, begin with 3 items that are completely to the left of the age line. These are items done by most children at an earlier age than the child being tested. The child probably will be able to do these items easily, which will increase his or her confidence and pleasure in doing the test. Items that use the same materials in the test kit, such as the blocks, may all be done consecutively to save time. Knowing which item to do next to maintain the flow of the test session is something that comes with practice. So that the child isn't distracted, remove test items from the tabletop when you're done with them. A good way to do this is to keep the test kit in your lap, out of sight of the child. Next, let's look at how individual test items are scored. Write a score large enough to be clearly visible on the bar as the 50th percentile hatch mark for each item being tested. Score a P when the child passes an item, and an F when the child fails an item. The child may have up to 3 trials to perform an item before you score it a fail. If you do it more than 3 times, you may be teaching instead of screening. And score R when the child refuses to do an item. A refusal cannot be scored with report items. child has had no opportunity to try an item. A no opportunity score can only be used with report items. To minimize refusals, tell children to do the items. Don't ask if they can, or they may refuse.
Okay, Nikita. Point to the longer line. That one? Okay.
If the child won't cooperate, you can ask the parent to administer an item. But if you do this, you must tell the parent exactly how to present it. At the end, check off the boxes on the front of the form that relate to the child's behavior. And ask the parent if the child's behavior during the test was typical.
Gina, was Matt's behavior today pretty typical for him?
Yes, it is.
Okay.
Any observations you have about the child or test may be recorded on the back of the form. New testers often wonder how many items to administer for each child. That will vary depending on the child's age and the purpose of screening. Let's look first at scoring when the goal is to identify children who are developmentally at risk.